Hey guys, welcome back to my channel. My name is Sandesh. I am the pharmacist over here in Australia, and in today's video I'll be talking about the scope of the pharmacist. What might be the scope, or what is the scope being a pharmacist? Every other person is asking. It is a good career, or it is the good time to pursue the profession as a pharmacist. Being a pharmacist, I love my profession. I like the profession. What many people will be saying that, but it's up to you. Many people might be talking bad about their profession. Many will be talking good about their profession. There are many reasons I like my profession. Also there is a lot more scope of the pharmacist in the future too, and many people are afraid, like by the involvement of the IT or the robots, or like AI thing. Will the scope of the pharmacist will be decreased? I'll be talking on that topic. Okay, stay till the end of the video, and hope everyone is getting benefit from my video. My main target is, and aim of my video is, everyone get benefit and they will be learning something from my video. So stay till the end of the video. Okay, as I'm practicing in South Australia, if I go through the rules of the South Australia and scope of the practice in the South Australia, being the pharmacist in today's date, I can do certain thing like counseling, and everything is normal. Counseling, dispensing, which is the normal part, which was previously there too. And there is a new, it has been a long time now, nearly 1 year I think. There is new thing known as UTI, urinary tract infection. We can prescribe the medication, we can give the medication to the certain age group. Certain criteria are there. You need to go through all the criteria. You need to do the, being the pharmacist also, you need to do the training on that one to provide that medication. That is also the newer scope, which is so much good. As South Australia has launched the course UTI, and people were like pharmacists were able to prescribe the UTI medication to the certain age group and certain people, then that was the good news for all the pharmacists, because if people love to contribute to the society and love to do something to the society, it the good practice. You are helping the people in the need. For example, in the late night, if you are working in the pharmacy in the late night, if people is suffering from the UTI, they will have so much of the trouble, like. But if you are working in the community pharmacy as a pharmacist till the late night, and someone came with the UTI symptoms, and you are there, they can believe you as a pharmacist. You are there to treat them. That is the good point of new scope, new practice of the pharmacist. Like I was talking about the UTI. Yes, UTI, if in the end of the day you are there to solve the community, so you will feel so much good about that one. Because being a pharmacist, you can help the people in their need, because in their, with the UTI symptoms, they might have the many side effect, and if they are not treated in the right time, it might cause the other infection, like bladder infection or the kidney infection too. There are many risks on that one too. So being a pharmacist, if you got those things, you will be happy within you. And yes, that is the main part that is making me happier, being a pharmacist, because I'm able to solve the people in their need. And second thing, the new course was the contraception essential, that allow the community pharmacy to provide certain of the contraceptive pills to the to certain of the age group. Okay, there are certain criteria, but being a pharmacist, if you have done that course, you can resupply the contraceptive medication, resupply the contraceptive medicine the people have already been used. But again, there is a certain criteria. Again, this is also the newer scope of the pharmacist. Being a pharmacist, that is the other scope. And also there is the scope like vaccination. There are certain vaccination, for example, Boostrix and flu vaccine, COVID vaccine, and other vaccine also, which you can do in the pharmacy. Being a pharmacist, you can initiate that vaccination, you can provide the services. if you have done the course of the vaccination, again you can't do randomly, you need to be certified vaccinator to do that. Yes, and if you are a vaccinator, you will know the importance of that one, and you will enjoy the scope of that one. Again, the government has introduced the prescription course in, I think in the Queensland, I think they have already started that course. It is a 1 year pilot program, and there is good news for the South Australian pharmacists also. They are starting this from the, I think, start of the 2026, and that is the good thing. Like for example, if you have the certain disease condition, you don't need to go initially, you don't need to go to the GP, no rush, no waiting time, nothing. You can go to your pharmacy, talk to your pharmacist, and in certain condition they can provide you the prescription for some of the medication. Now also there are certain medication like pharmacist only medication is also similar to that one, like pharmacists need to go through all the details to provide, clinical need to provide the pharmacist medication. But I think this is slightly different, like having the after doing the prescription course, you can prescribe some of the condition, you can treat some of the condition inside the pharmacy, but not as a pharmacist. It is like a pharmacist medication, not a pharmacist, sorry, it is not like a pharmacist medication, but it is the prescription medication. But if you are qualified for that one, you can treat some of the condition, which is one of the great point. I know many of the GP are not many of the GP and healthcare provider are not satisfied with the new law coming on, new rule coming on. But I think being a pharmacist, I think this is the best time and the best thing, because you know, with the, if you go to the hospital, there is a lot of waiting time. If you go to the GP visit also, it is so much time to get the GP. So you might need, sometimes need to wait 3 or 4 days, sometimes 2-3 days to get to get the to see your GP. So in that case, pharmacist plays a role to treat your condition, and going through certain disease condition, not all, because I agree for all the condition there might be, they might need the monitoring, like some of the condition they might need the blood test and all those going all the tests that need to be done to get the proper diagnosis. But I think government was not focusing on that one. Government was focusing on the condition they don't need the blood test and all those. I think for, and if they need the furthermore diagnosis, pharmacists need to send them to back to the GP. But being a pharmacist, it is the good initiation and the good thing, and that you will be diagnosing some of the condition if you have done that course, prescribing course. Yes, I heard that it was launching on this I think Jan or Feb, I'm not so sure, the start of this 2026. And I think government will be subsidizing the price. I think certain percent government will be paying and certain percent pharmacists need to pay. I'm not quite sure much detail on that one, you can go through the website. But again, that is the good point. So if you are willing to become the pharmacist in this time, it is good time. Yes, being a pharmacist, you will, if you like to work within the people, you like to make the impact in the people by your knowledge, then you will definitely feel the pharmacist is the right profession. And if you like the communication with the patient to make the impact in the patient life, then definitely go for that one. And saying the AI like take your job being a pharmacist, it won't. But I have seen some of the pharmacy has already introducing the robotic system, and that's a robotic arm, like in the shelf there are all the medication, then if you dispense certain medication, the arm will itself pick the medication and put that on the I think certain area, and you just need to pick from that area. It might decrease the workload, first thing. It might decrease the number of pharmacists, but completely it can't take the job of the pharmacist. So in 2025, it is the good profession. it is a good profession to start. Being the pharmacist, is the scope of pharmacist is increasing. It is the good time, right time. And if you like, if you are the overseas pharmacist who wanna to join, wanna to do the internship and join the profession, like Australian profession of the Australian pharmacist, it is basically the best time, and so go for that. There is a lot of shortage of the pharmacists here in Australia, so definitely you'll get a good opportunity here. You will learn many things over here. The system is slightly different rather than your home country or any other country, but you learn many things over here. And along with your knowledge, you can build a extra knowledge. You can develop a extra knowledge. You already, being a pharmacist, I know you already have the knowledge. I'm talking about the overseas pharmacist. You already have the knowledge, but additionally you will add the other knowledge to, you will be practicing on the lot higher scope of practice. So it will be great opportunity for everyone. So best of luck for all the pharmacists or the intern pharmacist, overseas pharmacists who are trying to come over here in the Australia to work as a pharmacist. Best of luck for everyone. You will be I know you will all do the good job, and best of luck again. Thank you so much for watching my video, being till the end of my video. I will be posting similar videos in the future too, so put the thumbs up on the comment section. I will know who was watching that one till the end, and put the thumbs up. And I will post the link of the if there is any important thing, I'll post the link of the document on the description too. Okay, thank you so much. Thank you for watching till the end. Again, like, comment and subscribe and share my channel to every people. It might be helpful for them.